From the PEP Radio Newsroom, this is the Hourly News Blast. Qburgh is reporting that the largest medical association in the United States supports gender-affirming care, a stance it has reiterated in different ways over the last 10 years. But as Republicans press leading medical organizations on health care for transgender youth, the American Medical Association is the largest group caught between political rhetoric and the complex realities of specialized care that few people receive. As patients, families and doctors navigate this care in an increasingly confusing and hostile landscape. What medical groups say matters. But lately, what they've had to say and how politicians interpret it has only caused more uncertainty. The AMA's stance was already in question after a January meeting between leaders of major medical groups and Dr. Mehmet Oz, the head of the Centers for Medicare and Medicaid Services. After that meeting, which was first reported by the New York Times, one group in attendance, the American Society of Plastic Surgeons, muddied the waters about whether it had taken a more restrictive stance on gender-affirming care. Questions soon followed for the AMA, the most prominent organization representing doctors in the nation. 20 Republican state attorneys general are pushing for the AMA to broadly oppose gender-affirming care for minors in response to news coverage about their recommendations around youth surgeries. The attorneys suggest that the AMA may be violating state consumer protection laws by confusing or even misleading medical providers and patients about their stance. They mention wanting to avoid a formal investigation into the issue. The attorneys, led by Steve Marshall in Alabama, wrote a letter in February asking whether the group recommends hormone therapy or puberty blockers to treat gender dysphoria in minors. If you agree that there is insufficient evidence to support using surgical interventions to treat gender dysphoria in minors, as your recent statement indicates, we do not understand how you can find that there is sufficient evidence to support using hormonal interventions to treat gender dysphoria in minors, their letter reads. This is an escalation of a familiar tactic, said Khadija Silver, Director of Gender Justice and Health Equity at Lawyers for Good Government. And if it works, it will be a major weapon in the political fight to delegitimize gender-affirming care, they said. If you can convince the public that they have shifted stance, that's extremely powerful, they said, referring to the American Medical Association. In some ways, that impact is already being felt. In a recent congressional hearing on rising healthcare costs, the Board of Trustees chair for the American Medical Association was asked about how patients across the country are struggling to find doctors. 2 hours into the hearing, he was also asked about gender-affirming care for trans youth, a topic that affects few Americans but takes up a heck of a lot of political air. Representative Aaron Houchin, a Republican from Indiana, asked why the medical group changed its position on surgeries for trans youth. But the AMA maintains that it has not, in fact, changed its position. In surgery and minors, our belief is that it should generally be deferred until adulthood, but we respect the physician-patient-family relationship in determining that. Dr. David H. Azus answered in response to the question from the Congresswoman. That exchange took only a few minutes out of a hearing that spanned the gamut of crises facing the U.S. healthcare system, like skyrocketing insurance premiums and a worsening physician shortage. But it represents a growing tension between Republicans and medical groups as elected officials who oppose gender-affirming care push for major healthcare organizations to do the same. The American Medical Association declined to comment on the Attorney General's letter, which had asked for a response by March 25th. In a broader statement, the medical group said it supports gender-affirming care. Quote, we support evidence-based treatment for medical care, including gender-affirming care, end quote, an AMA spokesperson said in an email. Currently, The evidence for surgical intervention in minors is insufficient for us to make a definitive statement. In the absence of clear evidence, surgical interventions in minors should be generally deferred to adulthood. Treatment decisions should be made between the physician and the patient and family based on the best medical evidence and clinical judgment. We'll have more on this story later this evening. That's our news blast for this hour. PEP Radio is available on the Live 365 app, the PEP Radio page at paequality.com, Roku, and Alexa. Up next, we have the Meadville area weather forecast here on PEP Radio.